Hi, I'm Dr. Megan Clowse from Duke University, and I want to talk today about how we have really changed how we talk to patients with lupus. So let's go back a few years to when I was at a regular old lupus clinic, and a patient would show up who really gave me a pretty good history for a remote history of lupus. She'd had rashes, she'd had arthritis, she used to have pretty significant autoantibodies, but all of that is now pretty much gone and has been gone for a long time. But she still feels terrible. She just has ongoing fatigue, a lot of achiness. She's not sleeping great. She just feels terrible. And she's just been passed often from doctor to doctor. And she is here to me, "Doctor, you're my last hope. What are we going to do?" And this is what I used to do. I used to say, "Well, yeah, it sounds like maybe you used to have lupus, but I really don't see it now. And, this is fibromyalgia, and you just need to go back to your primary care doctor and they can manage it for you." And she would be so disappointed, often kind of angry, sometimes kind of lash out verbally at me. And I felt terrible. I felt like a terrible doctor. I felt like I just wasn't helping people. That's what I was there for, was to help people. And I was just saying over and over again to new patients, to old patients, "Your lupus is fine. This is fibromyalgia. Go someplace else for care." So this was leading to a lot of burnout, to be quite honest. I was exhausted from all of this. And so we decided to take a step back and really kind of rethink what we were doing with lupus. And what we came to after doing some patient-reported measures for a little while was maybe there's like two halves to lupus. Maybe there's the inflammatory, kind of traditional, what we all were trained as lupus: arthritis, big rashes, nephritis, the stuff you see in the hospital all the time. But maybe there really is this other half of lupus in which patients just feel bad all the time. And maybe it actually gets better and worse, right? Like patients have for years been telling you, like, "Well, last week I felt terrible. I could barely get out of bed, but this week I feel a little better," right? You've been hearing that forever. So as we measured things over time, we really did see that patients seemed to kind of fall into a couple of different groups. Some actually felt good most of the time and their disease was under good control. Others had a lot of active inflammation in their kidneys, particularly, though sort of paradoxically actually felt pretty good. And we're always confused as to why we were telling them to take all of this medicine when they actually felt pretty much fine. But then there were these other patients who really I couldn't find sort of active inflammation, but they felt terrible. And then it turns out there was actually this other group of patients that we could find some significant inflammation in their joints or their skins or their kidneys, but they also felt really bad at the same time. So we've been exploring this. We call this type 1 and type 2 lupus, type 1 being the kind of traditional lupus, type 2 being the chronic, well, not actually always chronic, but often chronic, kind of achy, fatigue, brain fog stuff. And we've been really exploring it and looking for patterns and ways to treat it and ways to better understand it. But most importantly, it's really changed how we talk to patients. So whereas I used to say, "This is not your lupus, go someplace else," it really didn't match her lived experience, right? All of our patients tell you that this achy fatigue is their lupus. And in fact, when you ask a patient with lupus about what a flare is, it's really actually a flare of achy fatigue, brain fog, have to stay in bed a couple of days, almost in all patients. So we've now started to really frame it differently. We say, the good news is it looks like your type 1 lupus is under really good control. You're taking your meds, things seem really quiet for quite a long time. I expect that they'll probably stay like that because in our experience, the patients who get there and have been there for a while often stay really quite good. However, it really looks like this type 2 lupus is really a problem for you. And as you have learned, your lupus meds don't really make a big difference in it. So let's see if we can find some other strategies that might be helpful. Then we start talking about sort of all of the other health behaviors that people do to start feeling better, right? And that might include improving sleep. It might mean moving more. It might mean cleaning up their diet so they're not eating so much processed foods. It might mean dealing with the emotional baggage that they are carrying from our life of trauma or experience with other doctors or just the things that happen in life. So there's a lot that you can do to help people feel empowered to actually kind of take back their health. And we've really found that these discussions have transformed a lot of our patients' lives, but in the most immediate, they have made Lupus Clinic infinitely more pleasant for me. We would love to hear your insights after giving it a try. Thanks so much.